Hi there, I'm Dr. Rupa Parmar and I'm a private GP here at Midland Health. We use the acronym F.A.S.T, which stands for face, arms, slurred speech and time. Okay, so patients may experience drooping of the face, their arms may feel very weak, which means they can't raise them above their head. Their speech may be slightly slurred, odd, they might not be able to get their words out. And then T is for time, which is time is critical. So if you have any of those features, immediately call 999 because this could be the early signs of a stroke. A TIA, also known as a transient ischemic attack, is when the blood supply to the brain is temporarily starved. So patients may get symptoms which are mild but can present like stroke. So you may have slurred speech, changes in your facial symmetry, so drooping of the face, unable to drink or swallow. And these mild features often last less than 24 hours. Left untreated, a TIA can turn into a future stroke, and these are often the early warning signs that need intervention by a consultant neurologist and specialist. So stroke is a term that's used when the blood supply to the brain is starved and the cells in the brain cannot function in the same way that they used to. There's two different types of stroke: hemorrhagic stroke, which means a bleed on the brain, and ischemic stroke, which means starvation of blood to the brain. Both can present with very similar symptoms. Hemorrhagic strokes can be due to conditions due to abnormalities in the blood vessels within the brain. For example, a burst aneurysm could cause a hemorrhagic stroke. High blood pressure could cause a hemorrhagic stroke. Ischemic strokes, on the other hand, are due to starvation of the blood supply to the brain. This may be due to clotted blood vessels, due to plaque, debris, high fats, cholesterol, and all sorts of conditions that can starve the brain of oxygen. Prevention is vital. Managing blood pressure, controlling diabetes, stopping smoking, maintaining a healthy weight, keeping physically active, all significantly reduce your risk of stroke. Regular health checks and health screens can also reduce your risk of life-threatening conditions like a stroke. So at Midland Health, we've got access to a variety of tests, scans and specialists. We offer same-day blood testing. We can arrange scans of the brain, so MRIs and CT scans on the same day. We can also ensure that you are seen by a consultant neurologist who specialises in stroke. This means faster answers and a clear management plan without any unnecessary delays. The continuity of care means the same team will oversee your treatment journey from start to finish. If you are having any stroke symptoms or you're worried or concerned, please don't hesitate to contact us here at Midland Health by emailing the team or calling the clinic.